Okay. And you had talked about, different systems, digestive, musculoskeletal, endocrine. Do people know that these underlying conditions are going on? Like if you had, e- uh, endocrine system disorder, would you necessarily know that that was going on for you?
I mean, unless you've been to the doctor and you've been diagnosed with something, you wouldn't know it. For most people, these symptoms can be asymptomatic. I mean, the conditions could be asymptomatic, or they could slowly start manifesting. So they're noticing some effects of it, but they put it down to feeling tired, or it's too hot, or it's too cold, or I'm getting old, or it's normal because I'm aging. It's part of getting old, and it's actually not. We were kind of conditioned to think that it's okay to feel tired and to get lots of gray hair and get all wrinkly and lose the muscle mass and all the other aging signs of aging, where it really boils down to all these things that if you leave them unaddressed, then yes, they will progress, but if you identify them and address them, then they won't.
Okay, that makes sense. What could a woman do to find out if these are a factor for her?
Well, if you're a man or a woman living today and you're over 35, this will be a factor for you to an extent, because this is a time when, on average, people start to show some signs of aging and certain health issues start developing. So, the first thing to do would be to get your case analyzed by a practitioner who is trained in holistic and integrative medicine and who also understands fertility, because they would then be able to recommend tests based on the whole body symptoms to identify the underlying issues. And once these issues are identified, we can address them with supplements, with dietary changes, and lifestyle adjustments. So it's a pretty simple process once you know what you're dealing with. The reason why it seems so complex on the outset is because in the IVF clinic, you're not going to have the whole body approach. So you don't really know the underlying issues. You're just told your eggs are too old, or your sperm is no good, your hormones are too low, your uterine lining's too thin. So therefore use a surrogate, or just use donor eggs, or use donor sperm. So they're just trying to make the IVF procedure work with what they have. So, unfortunately, for many couples, this can result in a lot of mystery, confusion, and misery, plus wasted time and money. And also, old school conventional medicine doctors were trained, back in the 70s and maybe early 80s or 80s even. They were led to believe that diet and nutrition has nothing to do with your health, and it's all linked to your genes. So they don't really believe that nutrients can make a difference, but of course they can. We see that over and over, and there's so many studies documenting that as well.
I mean, I was always told that, and it might have changed by now, but that in medical school, most doctors get about 2 weeks of nutrition. I mean, it's definitely not their specialty, you know.
No, but it doesn't have to be, because there's so many things that they can do that we can't.
Yes.
They can stitch you up, they can give you drugs if for acute pneumonia, and they can do all sorts of amazing things. And it's great that there's so many different branches of medicine.
Hmm.
I come from a medical family, and my dad always said that there's one medicine with many different branches, and if all doctors could work together, collaborate, then that would be the best treatment for the patient, and that's what we should all strive towards.
Absolutely.